Good afternoon, everyone, and on behalf of the Office of Juvenile Justice and Delinquency Prevention, and in collaboration with the Justice Research and Statistics Association, I would like to welcome you to today's webinar, Implementing Risk Assessment Tools and Measuring Outcomes. My name is Jama Michael, and I am a Research Associate at JRSA, the Justice Research and Statistics Association in Washington, D.C. JRSA represents the state statistical analysis centers, which are responsible for collecting and analyzing state criminal justice data. We also conduct research and provide training and technical assistance that is of interest to data and evaluation folks across the country. One of the projects that we work on is the National Juvenile Justice Evaluation Center, which is co-hosting this webinar today. The purpose of the Juvenile Justice Evaluation Center is to improve the evaluation capacity of states, localities, and tribes and facilitate the use of evidence-based programs and practices in juvenile justice. As your moderator, I am happy to introduce today's panelists. Each of their photos and bios can be found in the handouts pod on your dashboard. The panelists are Dr. Gina Vincent, Associate Professor and Co-Director of the Law and Psychiatry Program in the Department of Psychiatry at the University of Massachusetts Medical School, Worcester, Massachusetts, and Mr. Clement, Regional Manager for the State of Louisiana for the Youth Services and the Office of Juvenile Justice. Today's topic provides important information to states, localities, and tribes considering the implementation of risk assessment tools at the disposition stage. Through the MacArthur Foundation's Models for Change initiative, the work that Dr. Vincent and Louisiana have done to systematically implement risk assessment tools provides us with a working model of evidence-based practices that embrace a developmental approach and can lead towards significant juvenile justice reforms. Now let's hear from OJJDP National Training and Technical Assistance Center. Callie Murray will share with you a few features of the Adobe Connect. Callie?
Good afternoon, everyone. As your technical host, I would like to take a few minutes to discuss the features of Adobe Connect, which will help you maximize your opportunity to participate in today's webinar. To download a copy of the PowerPoint slides and other important documents, locate the Handouts pod directly above the chat area. Click on the name of the file, then click the Download button. To send a chat message, type your message into the text box. Hit Enter or click the message bubble icon to send. For those of you participating in today's webinar as a group, please take a minute and help us count. Go to the chat window and type in the total number of additional people in the room with you today. This will help us with our final count. Again, if you are viewing with a larger group, please type in the number of additional people joining you today. If you are watching by yourself, there's no need to type anything at this time. There will be a Q&A session at the end of the webinar today. During that time, we will take every opportunity to address some of the questions you have posed during the presentation. Type your questions into the chat box as they arise. At the conclusion of today's webinar, you'll be provided with a link to take a 5-minute online survey about today's presentation. We appreciate your feedback regarding this webinar. This information is used to assist in future planning and training. You'll be able to access the evaluation link on the last slide of the PowerPoint. Finally, this event will be archived in OJJDP's online university in approximately 3 weeks. You can also check out past webinars by NJJEC that have been archived on the online university. Again, thank you for joining us today. I will now turn it back over to Jama.
And before we begin, I want to just take a couple of seconds to review the learning objectives for today's webinar. Number one, we want to provide an overview of key concepts in evidence-based risk assessment tools. Number two, discuss the steps Louisiana took to implement an evidence-based risk assessment tool. Number three, explore how data from risk tools can be used to inform practice and policy. And now, the first panelist is Dr. Gina Vincent.
All right. Hello. I'm getting my webcam up here. Okay. Well, good afternoon, everybody, and thank you for attending the webinar this afternoon. I also want to thank JAMA and OJJDP for hosting this, and Callie as well for putting this on and asking Kelly and I to present. I think that Louisiana and some of the work they've done there is a great model for how to implement risk assessment and how to report some of your data. So I'm really excited that Kelly is going to be presenting with me. Okay. All right. I saw many of you who have signed in, and I am familiar with some of the names, and that's wonderful. And I wanted to let you all know that I'm going to start out by just giving kind of an overview of why risk assessment is important and how it can be useful in the juvenile justice system. For some of you, you have heard this before, but it never hurts to have a little bit of a review. I also should mention that, as many of you probably know, risk assessment is utilized at many different points in the juvenile justice system. And so we have different types of risk assessment tools, some that are designed for different purposes, and they may look very different. So what we're focusing on today is just tools for predisposition use or dispositional planning. Some people sometimes implement these pre-adjudication, but the end result is that these tools are being used in your dispositional planning and guiding kind of case plans and guiding what youth might do while they're in probation or while they're in some other program. So that's going to be the focus today. So there's some research evidence that we consider to be guiding principles as to explain why risk assessment is important. One of the main pieces there is that punitive sanctions or just having some kind of consequence in place in itself does not have a significant effect on reoffending. Now, it may have an effect on reoffending if it's combined with good services, but punitive sanctions or consequences alone don't necessarily have a significant effect on reoffending. There's research that has looked at adolescents and children actually as well who got into trouble or did things that would get them into trouble with the law. And they compared kids who got involved in the juvenile justice system to kids who didn't. And what they determined is that all else being equal, youth who engaged in some of the same delinquent behaviors did worse later in life if they had penetrated the juvenile justice system. So for example, youth who got a small sanction, even something just like community service, while they were an adolescent, were twice as likely to end up with an adult arrest as youth who also committed some delinquent acts but didn't penetrate the juvenile justice system at all. Youth who ended up on probation were about 12 times as likely as the other youth to end up with an adult arrest, and so on and so forth. The deeper they penetrated the system, the greater the likelihood later of ending up with an adult arrest. And that's after trying to factor out a lot of other things that may make these kids somewhat different. Second, there is good evidence from the Pathways to Desistance study, which is an amazing study that many of you have probably heard of, which has been done in Pennsylvania and Arizona with more serious offender, felony offender youth, most of which ended up in custody. I think all of them ended up in custody at some point. And what they've found, and this is also echoed by other research from the past, is that the severity of one's offense doesn't really tell us a whole lot about what that person's going to do in the future. So this is how our justice system works. Our criminal justice system and our juvenile justice systems both operate in a way where it's kind of you do the time for the crime. However, the offense that was committed in and of itself really doesn't tell us much about that person's future likelihood of violent offending or future likelihood of serious offending or what they're going to do 5 years from now. So the severity of one's offense is really not the best predictor of what that person's going to do later in life. So for that reason, we probably want additional information about youth to help us in deciding what their disposition should be and to help us deciding what their case plan should be. Lastly, there's some evidence from the Pathways to Desistance study that confinement has diminishing returns after 6 months or so. So it may have an impact on reoffending up until the 6-month point, and after that, you're really not getting a whole lot of bang for your buck. There's also research evidence indicating that most low-risk youth, by definition, are unlikely to reoffend even if there's no intervention. So even if we don't do much of anything with the lower-risk youth, they're unlikely to engage in continued delinquent behavior and certainly unlikely to engage in serious delinquent behavior. However, if we mix them with higher-risk youth, there's some notion out there that may make them worse. And we all know that in this age group, when we're dealing with adolescents, some of the people who have the largest influence in their life are their peers. And so if we're putting the lower risk kids, the youth who haven't really been exposed to a lot of delinquent activity, maybe they're not abusing drugs yet, maybe they're not doing any of those things, we start mixing them with higher risk kids or maybe more delinquent kids, that may be a better way of saying it, we can actually kind of create this situation where they're learning from each other, and that is not necessarily effective. Now, obviously, the juvenile justice system does not have complete 100% control over all the peers that these kids are going to be associating with. They associate with them in school and things as well. But it's important. It's an important principle to keep in mind that we want to try to sort youth based on their risk level to the best extent that we can possible. Okay. Lastly, there is good evidence, or evidence is increasing that when we match services to kids' actual level of risk and their delinquency producing or criminogenic needs, as they've come to be known, we'll have a better chance of reducing their offending. So if we can match services to what those youth actually need, that's going to give us the most bang for our buck. If we're just matching services to whatever offense the kid committed, that's really not telling us a whole lot. We're not likely to get a lot of bang for our buck. So this is where assessment becomes really important in helping us do individualized case planning. Why all these points are important to remember is that, first of all, we're striving for sorting youth based on risk level to the extent that we are able to do that. Now, I know we can't do that 100%. Obviously, if a youth commits a really serious offense and they come out low risk on a risk assessment tool, it's unlikely that any court is just going to let that youth go, because disposition decisions are also going to be based to some extent on the offense committed. But wherever we can have flexibility to base our disposition decisions and our case planning on the youth risk assessment, we're going to do a lot better. We're going to get a lot further with those kids. There's also good evidence that, of course, when we put youth in community programs, especially evidence-based community programs, we're saving money. We're getting more bang for our buck. These are taxpayer dollars. So for every dollar spent on functional family therapy as opposed to being spent on incarceration, we're saving about $28. Now, this is based on data from one state, the state of Washington. I believe other states are getting funds, some types of federal funds, probably to start doing some of this on their own as well. But there is good evidence that obviously we're saving money when we don't incarcerate youth and we don't put them in detention, but instead we treat them in evidence-based community services. So here's a schematic of what we're striving for. The idea is to try to do risk assessment as early in the process as possible. That is definitely predisposition. If you can do the risk assessment predisposition, then it can be used to help influence the disposition decision. And then, which I tend to separate these. I know that these aren't seen as separate in a lot of states, but when we think about the disposition in terms of what type of consequence the youth is going to have, are they going to go to probation, or are they going to go into some type of out-of-home placement, such as a group home or a correctional facility? That's the disposition piece that we're talking about. So where does the youth end up? Or are they just going to get some kind of minor consequence like community service? There's also post-disposition case planning, which probation generally in most states has a lot of control over. That's not true in all states, but in states where probation has a lot of control over this, they can assign services ideally based on those risk assessment results. So the idea is to do it as early in the process as possible, so it's informing all of the other things that are going to happen with this youth throughout the system. Now, some states have done a very good job of implementing comprehensive risk assessment tools pre-adjudication as well. And those states that have managed to pull that off really well are those that have good information sharing protections in place. Pennsylvania is a great example of that, where they've been able to do the risk assessment at probation intake. It still informs all of these decisions, but it also informs decisions that some of us might consider to be diversion practices. So some places have opted to implement comprehensive risk assessment tools pre-adjudication. There's some extra levels of challenges there when you do that, but again, it helps with the decision-making process really early on when you can. Okay, now adopting a risk assessment tool alone, just picking up a tool and deciding this is the one you're going to use and training your staff how to fill it out is not enough. And actually, we have some good research demonstrating that in and of itself is not enough. It really needs to be paired with a good case management approach or case management plan that involves training probation officers how to use the risk assessment tool in their recommendations and in their case planning decisions. Risk need responsivity, otherwise known as R&R, is one of the most common ones. This probably has more research behind it than any other case management approach I've seen. A lot of that research comes from the adult arena, but there is quite a bit of research studies now with juveniles as well, showing that this approach works. Although there's less juvenile studies than adult studies. The general concept is very easy, I think, that the risk principle tells us we want to match the intensity of the intervention with one's level of risk for reoffending. So whatever it is that we're going to do with those youth, we want to match that to their risk level, be it supervision. So supervision on probation, higher risk kids get supervised more, lower risk kids get supervised less. The higher risk kids might be seen as having more potential for the need of an out-of-home placement. However, the mere fact that someone is high risk does not mean they have to go into an out-of-home placement or a correctional facility to protect public safety. There's a lot of high-risk kids that can be managed safely in the community if you have the resources to manage them. So that's the risk principle. Match the intensity to the risk level, period. The next principle is the need principle, and that means that we want to take whatever needs those youth have that are identified in the risk assessment tool and match those to their services. So there's what we call risk factors that are dynamic. Those are also known as criminogenic needs. There are some subtle nuances between the terms dynamic risk factors and criminogenic needs that I'm not going to get into. But essentially, these are things that increase the likelihood that a youth is going to reoffend, such as substance abuse or poor parental monitoring or having a lot of negative peer associations. Those are all risk factors that increase the likelihood that someone's going to reoffend. However, there are also things that we can target for intervention because in theory, these are things that change over time. So substance abuse can be treated, can be changed over time. There's research showing that if you treat the substance abuse, you actually reduce the reoffending. Okay, so that's the need principle. The last principle is responsivity, and that means this is where I see the case planning as an art. You want to match the mode and strategies of services with the individual's needs. So for example, if you have a youth who's a girl, you want to put them in girl-related programs, not boy-related programs. If you have a youth who speaks English as a second language, you want to put them in a kind of service that's going to be able to address their language speaking skills. If you have a youth with some kinds of cognitive impairments, you're probably not going to want to put them in a cognitive behavioral therapy program. So this just means matching youth based on some of their individual characteristics. All right, and this next graph is data from one study that was done on probation that shows the good outcomes of when you match youth services to their actual needs. So these are recidivism levels for a sample of over 100 kids who were on probation. The researchers took the YLS risk assessment tool and looked to see what needs these youth had from that and their clinical assessments, and then went and saw whether they got their needs met while they were on probation. So if they had a substance abuse need, was it addressed by a service? If they had a problem with peer associations, did they get some kind of service that dealt with how to deal with negative peers or how to get more positive peer groups, and so on and so forth. The kids in the poor match group recidivated at a rate of 75%. These are the kids who got services while they were on probation, but those services really had very little to do with what those kids' actual needs were. So irrespective of the number of services received, if the service wasn't matched to the used problem, they had high recidivism rates. In the good match group, those were kids who had most of their needs addressed by a service, and you can see the recidivism rates for those youth were much lower. We have data from a MacArthur-funded study known as a Risk Needs Assessment in Juvenile Probation Implementation Study. It was done in Louisiana and in Pennsylvania, where we helped these places or worked with these places to implement evidence-based risk assessment tools and did a pre-post quasi-experimental study designed to see how that changed or whether it changed at all the way they handled case planning in those counties. This goes back to the whole need for looking at outcomes, because our interest was in whether or not these tools lead to any change in the day-to-day practice and how we actually handle youth. What we found is that in most places there was a significant reduction in the use of more serious dispositions. So the dispositions that were being used were more commonly less severe. Placement at disposition went down significantly in the majority of these places. Most kids got probation. In Pennsylvania, where they implemented the tool pre-adjudication, you found more youth ended up on consent decree or informal adjustment, and less youth ended up on probation once a risk assessment tool was implemented. We also found there was a significant reduction in out-of-home placement rates in many, but not all, of the sites. So sites that are having over a 30% out-of-home placement rate during the first year that kids are on probation had that go down significantly, and in some places it dropped by 50%. And by out-of-home placement, I'm including detention, short-time detention stays. I'm also including correctional placements and group homes. There was a greater use of lower levels of supervision, so probation officers were supervising more kids less. They were only supervising the higher risk kids more. They reallocated their services according to risk level. So high-risk kids got more services and low-risk kids got less. And with all of these changes, indicating that more kids were out on the street being treated in the community, less youth were getting a ton of services, and less youth were being supervised heavily. Even with all of these changes, there was no increase in any site with respect to their reoffending rates. So those were good payoffs. And those are all things that you may want to track if you're implementing a tool. There are three components necessary for these kinds of positive changes to occur. First of all, the risk assessment instrument you use should be valid, which means that it should actually predict or be related to reoffending, and it should be comprehensive so it can be helpful for dispositional planning. Second, the instrument should be paired with some kind of valid case management practice, so your probation officers are trained how to use that tool in their decisions. And third, quality implementation that also involves data gathering and tracking outcomes is essential. And the implementation is going to be the focus of most of the rest of our talk today, but I'm going to quickly cover each one of these points. First, when I spoke about the risk assessment instrument being valid, we recommend that your tool have a few characteristics. First of all, there should be a manual, even if it's really short, some kind of manual that describes how the tool should be administered. So how is information supposed to be gathered? Is it supposed to be done based on an interview with the youth, or with collateral information, or an interview with a parent, or all of the above? There should be some manual describing that and describing how all the items are rated. Second, the tool should have been designed for, or at least validated with, juvenile justice youth. These are the youth that we're dealing with, and you want the tool, a tool that's designed for youth in the particular setting in which you're working. So there's some tools that have been designed for institutional use, and there's some tools that have been designed for community use, and then there's tools that have been validated in both settings. You just want to make sure that you're using the right kind of tool for what you need. Third, we recommend that the tool be based on youth development, literature, and delinquency research. What that means is that it contains items that are capable of change and can be used in reassessment, because we know that kids' risk changes over time. For most adolescents, it's going to desist or go down, or it changes over time. Their needs may also change over time. Fourth, there should be some evidence that the tool can be rated reliably, or at least you have got some evidence within your office that your probation officers are trained at a level where they're doing this reliably. Fifth, you want some evidence that the tool is valid, again, that it predicts reoffending, and lastly, capable of measuring change, which I already mentioned. So we talk about comprehensive risk assessment tools as containing all of these features. They'll generally have risk factors in them that can't change. They'll have risk factors in them that can change. We call these dynamic risk factors, or these sometimes are going to end up being your criminogenic needs. And these are what enable you to do reassessments down the line. We also recommend that your tool have some measure of protective factors or strengths, because these are also things that you can use in case management to capitalize on, or help buffer the used risk. So those are also very good features to have in tools. The last point I made is that quality implementation is crucial. This is key. We have several studies that have come out of that MacArthur, several publications that have come out of that MacArthur study that I mentioned. One of them, we actually were able to look at what happened in a probation office when they adopted a tool. They had a good evidence-based, valid tool. They trained their staff how to fill it out, how to conduct the assessment with kids. But then they didn't have any policies in place about how the staff were supposed to use the tool in their decisions. They didn't have the buy-in yet from all their stakeholders. They hadn't set things up so that staff really knew how to assign risk supervision levels based on risk level. A lot of these features about the implementation were not in place yet. And what we found is that until all of these components were present, that actually low-risk youth were getting more services than high-risk youth, which is the exact opposite of what the risk needs responsivity model would suggest. And that's largely human nature. It makes sense that people want to work more with lower risk youth because they're more receptive to being worked with. You can see the benefits. They're more willing. And so the human nature for a lot of people is going to be to spend more time with those low-risk youth and not as much time with a high-risk youth who may be seen as a real pain to work with. So it's a shift in thinking, this whole risk-needs responsivity approach, and this shift about allocating resources and spending more time with higher-risk kids and less time with lower-risk kids. It's a shift in a lot of thinking for probation officers, and this is an implementation issue that really requires some good training and thinking about the challenges that probation officers are going to face when they may move to this model if they're not used to it. So based on that research and a lot of the work that we did in Louisiana with people like Kelly, who's going to be talking next, and Pennsylvania, Rick Steele, and Beth Fritz, and Keith Snyder, a lot of great, really dedicated people, we put together this manual. There was a large advisory group of individuals that I just mentioned, as well as individuals who are developers of risk assessment tools. JAMA and other attorneys were involved in the development of this, as well as judges. So there were about 30 people involved in the development of this manual, which was also funded by the MacArthur Foundation, which really outlines all the steps to implementing a risk assessment tool well. And the manual focuses largely on probation. However, the majority of the concepts can be transferred very well to institutional settings, or even in some sense diversion types of programs. It outlines 8 steps that we came up with that are crucial. The manual, I believe, is included as a handout. It's completely free and online, and it's included as a handout if folks want to download it in this webinar. And I'm going to turn this over to Kelly now, who is going to go through each of these 8 steps and explain to you how they implemented those in Louisiana. And then I'll cut back in towards the end for some other comments. So I'm going to turn it over to Kelly now.
Okay. Thank you, Gina.
Welcome.
I'm trying to change the next slide, but...
You got to use the arrows at the bottom.
Yeah. Okay, I think I have it. Okay, good afternoon. As Gina said, no, I'm not working still.
You have the arrows at the bottom?
Yeah.
I just did that. Do you want me to do it for you?
Yeah, I guess. Yeah, if you don't mind.
Sure.
Okay, so good afternoon. As Gina said, my name is Kelly Clement, and I am a regional manager with the Office of Juvenile Justice here in Louisiana, but probably more importantly, I'm also the state coordinator for the SAVE, which is our assessment tool, and so we've been working with Gina for quite a few years now, and hopefully I can share some of the information that, lessons learned, so to speak, and also provide you some data at the end to kind of fill you in on where we've been and where we're at now. So the first thing we did was in 2007, we were going through a reform effort, and one of the things that we realized was that we definitely needed to have an assessment tool in place to assist us with furthering our reform. One second. Okay, thanks.
Hey Kelly, you want to start your webcam?
I'm sorry?
You want to start your webcam?
Oh, I thought it was started. Okay, maybe that'll...
There we go.
Okay, sorry about that, y'all. So what we did is in 2007 realized that we definitely needed some type of assessment tool to assist us with our reform efforts. And we wanted to make sure that we had something that would identify the needs of a youth in order to provide effective treatment, and that we had a way of targeting the resources to make sure the appropriate kids were getting the appropriate services. So fortunately for us, we were awarded a Models for Change grant, which included assistance from NISAP, specifically Dr. Vincent, in assisting us in selecting an appropriate tool. And so at that point, we decided that we needed to really start focusing on our selection process. So with the help of Dr. Vincent, we were, oh wait, I'm sorry. Let me backtrack a second. What we did know we wanted at that point was we wanted something that would be evidence-based. We wanted to make sure that we had something that the probation officers can complete and that it wasn't just for our clinicians. We also realized that we needed something with risk-need factors that could guide our interventions and help us with our case planning, and a tool that had dynamic factors that could be used for reassessments. That was our way of measuring the youth progress. And lastly, we needed something that would be cost-effective. And so at that point, again, we were fortunate enough to receive a grant from the MacArthur Foundation, which allowed us to work with Dr. Vincent in helping us select which tool would suit us best. And so she was able to present to us the 4 leading tools that would meet the criteria that we were looking for. And along with 5 local probation departments throughout the state and the Office of Juvenile Justice, who handles probation statewide, we came to the conclusion that the SAVRI, which is the Structured Assessment for Risk Violence, that we would be able to use that tool and it would suit all of our needs. So it was a great opportunity for all probation departments to basically speak the same language and monitor the youth using the same tool. And as you can see, the tool consisted of 24 risk items, 10 were static and 14 were dynamic. And this was very important, as I mentioned before, because we wanted some items that could actually change, that if we implemented the proper services, that the youth's risk could be reduced. And I know Dr. Vincent mentioned it, but I'm going to mention it again. One thing that we found very valuable was the fact that this tool included protective factors, because we do find that when the youth has certain protective factors, that it can help reduce some of those risks as well. Okay, so what we decided at that point was that we would use the tool for post-adjudication predisposition when possible, and in some courts when they did not require a predisposition report, we would also use the tool for post-disposition to help with case planning. And the local probation officers that I mentioned before were also using the tool in the same way. So we actually have 11 regional offices throughout the state. We have numerous non-secure residential type programs that we use, and we have 3 secure facilities. So what worked really well, and it's kind of unique, is that we use the same assessment tool throughout the entire process. So if a youth gets put on probation, we're going to complete an initial SAVRI. And if somewhere down the line the youth ends up needing residential care, then we will continue that same assessment with reassessments throughout his stay there or in secure care, and then once back on parole. So we're able to use the same assessment tool and base our decisions and look at progress using the exact same tool throughout the entire system, throughout the entire state, which has been a very, very great tool to do that with. So as we began to implement this, one thing we did realize was that buy-in was going to be essential. As many of you know, if you work in pretty much anywhere, but in a probation department, it would not be successful unless we had the buy-in of many people. And so some of these people that we needed to target were the administration, our staff, judges, district attorneys, the youth attorneys, and pretty much any stakeholder that we worked with. We needed to get involved so that everybody would be speaking the same language and everybody would have an understanding of what we were using the tool for and how important it was to have something that was evidence-based guiding our decisions. So one of the ways or a few of the ways that we were able to get buy-in from the staff was to start off by providing just an initial overall orientation training about the tool itself. This was going to be something new to staff that they weren't familiar with, so we kind of wanted to just kind of give them an overview of what to expect. One of the key questions that we focused on for staff is basically what's in it for me, because we knew that there would be a lot of questions and that the probation officers want to know, okay, here's another change, what's going to happen now? So we were able to basically explain to the staff that by using a tool like the Savory, it would guide them and would assist in making sure that we were more effective and efficient. It also would benefit the youth that we serve, which is very important to the probation officers. And then also, we looked at what documents are we using now that would be replacing those documents. This, I think, was very key because if, when we work in these departments, a lot of times we have changes and things keep getting added on, new way of doing things, and a lot of times we forget to take things away. And I think time is always very important factor when you're considering this. So when we were able to explain to staff that we weren't just going to add something on, but we were actually going to replace it with other things, I think that had a huge impact on their acceptance of the change. Another thing I think that was very, very important was selecting the proper employees to make sure they were on board and they would give the training. So we needed to have respected co-workers providing the training, someone that most people in that regional office would respect and listen to. And then we also wanted to make sure that we explained how the assessment would drive their decision making. And also we encouraged input. One thing that we did in these orientation trainings was make sure that they had an understanding that throughout this entire process that they would have input and that we wanted to hear what they had to say and that changes could be made based on their input. Okay? So the next step was basically beginning to develop our policies. So we had to really take a good look at the policies that we had in place, and we needed to see which policies were going to be affected. But we also needed to see which new policies we would need to add in order to effectively put the Savory in place. We wanted to make sure that when we were creating these policies that we had input from our master trainers as well as all other staff, that the administration would approve these policies, and we also wanted to make sure that the policies remained in draft form for quite a period of time. And in fact, we left the policies in draft form for probably close to a year, just so that we could make changes easily as the officers began to use the tool. And more questions came up about, what do I do in this kind of situation? So again, we just wanted to make sure that all staff had the opportunity to give ongoing feedback on these policies and make sure that they could see that their input did make a difference. And it was very, very vital to the process. After we were able to develop the policies, that's when the training began. So what we did is we have 11 regional officers, so we selected 4 regional officers to be our pilot regions. And this occurred in November of 2008, where we began with our initial orientation training. And then the master trainers were selected, and they received the Savory and Case Planning training in February of 2009. Once they were trained and, felt somewhat comfortable with the tool, then we were able to begin implementing the training to the field officers, and that took place in May of 2009. So it's a process, but it's very important that everybody is properly trained before full implementation. So again, after we implemented the pilot sites and we had it up and running, then to get it up and running by June of 2009, we were full force with the pilot regions. They were able to begin doing initial assessments on new cases, and what we did in order to roll it out was, for a 3-month period, we allowed the youth who were already scheduled for some type of reassessment based on our old methods. That's when we implemented the new initial assessment on those cases. So after 3 months of implementation, which began on June of 2009, after 3 months, every youth on probation in these pilot parishes had initial Savory completed, and we were well on our way with the pilot parishes. So we monitored the pilot parishes for a while, and then we began implementation in our non-pilot regions, where, again, we just kind of followed the same process. We selected our master trainers from each of the regions, and we started the process. Again, we just started over using these other regions. Now, what we did is we selected 2 to 3 master trainers from each of those regional offices and had them trained, and they then in turn trained their staffs. And so after we were able to get the non-pilot regions on board and get everything somewhat settled in the field, then what we did is brought on our facilities, and we began the implementation of the Savory in the secure facilities as well as our non-secure facilities. So in the field, the Savory is conducted by the assigned probation officer, and then once a youth is moved into a secure facility, the Savory is continued on the same 6-month track, but it's completed by one of the social workers who's assigned to the youth in secure care. And again, the reverse happens. Once the youth may earn an early release and come out on parole, then his probation officer picks up on the same schedule, completing these reassessments. So what's important is that we go from the assessment to the case planning. And so we do a thorough assessment with the youth and parent to complete a social history or a predisposition investigation, depending on the case. And then the information that we're able to gather from this intensive meeting is gives us the information so that we can actually complete the assessment itself. Once we've completed the assessment, this leads us to our service plan, which is our case planning, which is based on those risks and needs that were identified from the assessment. And which has all of the services that are available in certain certain areas where the youth resides. And we're able to take a look at, if he's a moderate risk kid and he has a need area in substance abuse, for instance, then we're able to take a look and match what services would address a moderate level kid with substance abuse needs. And we're able to select those services from that. As Dr. Vincent mentioned, we really have worked hard and are very careful not to put the low-risk youth in high-risk programs and vice versa. So this matrix really assists us in making sure that we don't do that. We also need to make sure that we have a way to relay the findings of the SAVRE to the courts. So we use this information to provide the court with recommendations. So we are doing narrative socials or predisposition investigations that cover the content that's related to the youth risk or incriminogenic need factors. We also are able to give them a determination of risk level to factor in the disposition and the intensity of the services that we would feel are required based on those the assessment. We also make sure that we include enough detail to support the service or program that we're recommending. And again, this should be based on the criminogenic needs. We have had great success with this because it's no longer a probation officer going into court and basically telling the judge, this is what I think he needs. Instead, we're able to provide the findings of the SAVRE and show the court that based on an evidence-based tool, this is what the youth needs. So that's worked very well for us. Also, service planning is very, very important, and we have to make sure that our staff uses the assessment to guide this planning. It needs to directly relate to the results of the SAVRE, to the risk and the needs that have been identified from the assessment tool. We're able to develop goals based on these identified risks and needs. And as I stated before, we do reassessments using this tool. So every 6 months, we're able to complete the assessment again and incorporate any new information into the service plan based on the youth progress or sometimes lack of in that last 6-month period. We also make sure that we provide regular monitoring and updating when the youth experiences major changes, because that can definitely have an impact on some of his need areas as well. Every tool out there comes with some potential barriers, and this assessment tool that we selected was no different. And so one of these barriers would be judges that do not, or for some reason, or cannot make the decisions based on the assessment recommendations. So that's why it was so important, as I stated before, with buy-in from the judges and from the attorneys that work with the youth, was so that they would have a comfort level and help us to present these findings based on the SAVRE and accept and adopt those findings. Another barrier is that sometimes you have people who complete a tool and they have a preconceived notion of what the findings are going to be. And so that can be very dangerous because we need to make sure that the tool does its work. One of the things that I took a look at when we first implemented this tool was meeting with a lot of probation officers and asking them about the youth that they were serving, and to give me an idea of how many of the youth that were in their caseload were high risk. And one of the things that I found was that pretty much everybody had at least 50%, if not much more, of the kids that they were servicing that were high risk based on their what they thought. And so it was really interesting when we began to roll this out and the SAVRE began to be used, that they found out that less than 20% of the youth in their caseload were actually high risk. So, and we'll have some other data on that in a little bit. But I say this because, again, had they used preconceived notions to help determine the end result, then our picture would look a lot different. Another barrier that can come up is the amount of time that it can take to complete an assessment tool. And again, this varies depending on the tool itself, but one of the main concerns that staff had, and honestly myself as well, when we were beginning to implement the SAVRE was the amount of time that this could take. And it does take quite a while to make sure that you have all of the information you need to complete the SAVRE. But what we found is that, like anything else, initially it took a lot longer to do than it did, 6 months after and a year after and even 2 years after. So I think once the staff became more comfortable with the tool, then it did take a lot less time than when we first started. So getting over that hump was somewhat of a task, but it did pan out. And, now it's just the way we do things. And so nobody really considers the amount of time that it takes because they see the benefit from it. And then another barrier also would be that if you have anyone that relies solely on the risk needs from the assessment without taking anything else into consideration. Our policy does require that in addition to the findings of the SAVRE, that we consider psychological and psychiatric evaluations if we have information from that, school records, treatment notes, and that type of information. So it's very important not to think that the assessment itself is going to drive all decisions. This is just one key element and one piece of the puzzle in implementing any assessment tool. So there are potential barriers, but like I said, if you can just continuously work on these things, that you can usually overcome them. The next thing I want to kind of jump into is some of the talk about data collection. And this is, as Dr. Vincent said, this is very, very important. And when I began implementing the SAVRE as the coordinator, I may not have realized just how vital this part of implementing the assessment was. But again, lessons learned. Dr. Vincent kept stressing to me how important it was, and then I began to realize how correct she was. So one of the things we need to make sure that happens in implementing a tool is that the discussions regarding the data collection begin during the planning stages of implementation, especially because it's a lot easier when you start discussing what data you're going to need and why you're going to need it, that you start collecting it on the front end. 2 years later, say, well, we would like to know this information, but yet you haven't been using a system that's been collecting that. Makes it very difficult to go back and get. So again, it's very important. And what you want to do is make sure that you start including in these planning stages your IT people, your people that are over your quality assurance, and those types of folks, so that they can be on the front end, and instead of being pulled in later on, once they probably feel it's too late to give you what you need. So as we talk about the data collection, we also want to talk about data reporting. And so the quality assurance is very important for this data. We want to make sure that probation officers who are routinely having ratings much higher or lower than the norm, that we're able to take a look at that. And we want to also make sure that we're looking at the inter-rater reliability. So what we do here in Louisiana is we look at regional offices as a whole and compare it to the state data. We're also able to go down to the individual probation officer and take a look at their ratings. And so it just kind of helps us for training purposes as well. If we see anyone that looks like they're struggling, we're able to catch that. But it's great to have that built in for quality assurance and make sure that people understand how to use the tool and that there's something's not happening, that they're just automatically assigning some type of rating. We also use this data for an allocation of resources. We're able to take a look at the risk levels and the predominant need areas. So this has been very useful in guiding us with what resources do we have an abundance of, but yet we maybe don't have that great a need for, and what resources are we lacking. And then we can kind of shift some of the funding when that happens. And also, we want to make sure that we have an evaluation of use of the assessment in decision making. So we take a look at the need areas or the risk areas and need areas that are being identified by the assessment, and we're able to match that with the case planning to make sure that the information is actually being used to provide the proper services to youth. We'd also look at the SAVRE to determine is staff using the SAVRE properly to make placement recommendations. And also we can take a look and see are programs being successful based on this information as well. So the next thing, we're going to kind of change a little bit direction and just kind of share a little bit of the data that we have been able to collect. And so the first slide is the initial SAVRE risk rating by region. So it's just kind of to show you how we can see the ratings based on the region where they're located. And so we're able to see, oh wait, I'm sorry, I backtracked 1 second. The first thing, I just want to kind of show an overview of what we look like here in Louisiana based on our ratings from 2014. And so as you can see, a large majority of our youth are moderate risk. And if you look at the pie chart on the right, that's actually for violence. And the one on the left is for delinquent behavior. But you can see that a large majority of our youth are moderate. We have a fair amount of low. But what really makes it interesting is if you look at the red, that's our high level ratings. And so again, where we talked about asking probation officers, how many high-risk kids do you think you have in your caseload? And I was getting things like 50, 70%, 75. This is the reality of the high risk. So this is really great to see because it shows us who we should be focusing on is that red area. And so the time that the probation officer does have to devote to cases, we want to make sure it's not all spent on these low-risk kids who probably do not need us anyway. So then the next slide, which I'm sorry I jumped ahead to, is actually an initial SAVRE risk ratings by region. So again, this as a quality assurance type tool, it shows me, which regions have, the higher ratings and which ones have an abundance of low ratings. And so we have these conversations with the regional managers in each of those regions to find out, why might that be? And so we can, again, dig deep and determine, like, for New Orleans, for instance, if it's, we have higher risk ratings higher than the state average, why is that? And we don't just accept the fact that, well, it's a metropolitan area, so we should expect that. We dig a little deeper and see, if maybe that our area might have better diversion programs than some, so that maybe the low-risk youth aren't making it into our system, which would be a great thing if that were the case. But anyway, we're able to really take a look at each region and compare each region to one another. The next slide is the initial savory risk ratings for 2014 by need area. So this is awesome too, because we're able to take a look at, as I stated before, where do we have the, youth who have the highest need areas, and we're able to determine that, disruptive behavior or mental health in peers would be our top 3 need areas across the state. And so we're able to align services based on some of this information. And just an FYI, that has not changed very much since implementation. Every year it seems that we keep with that same pattern. So we're able to use that information to assist us with services. Then the next slide is going to talk about the placement decisions. So this slide is a current slide, and it shows the youth who rated low on the savory. And so I'm very pleased to say that if you see in the green, large majority of the youth that were serving that are low are remaining in the community. It would be very upsetting if it was otherwise. And so very few, 7% would be in an out-of-home placement for secure and 7% for non-secure. And sometimes there is a reason for that. It's never going to be 100% like we'd like it, because sometimes we might have a youth who had a very heinous crime but actually scored low on the savory. But sometimes it still may require some kind of confinement because of state statutes. So that does happen on occasion. But large majority of the youth rating low are remaining in the community where they should be. So that's, again, something that we want to make sure we take a look at often. And then we'll take a look at the rating for the kids who scored a high rating on the savory currently. And you can see that a large majority do remain in the community as well. But this is where some of the youth do end up in our secure care settings, which would be expected. But Dr. Vincent mentioned this before, and I want to reiterate this, that the way we look at things is that in order for a youth to be in our secure care facility, he should be a high-risk youth. However, not all high-risk youth should be in secure care. So we're able to serve a lot of high-risk kids in the community. And so that's very important to note. And then as we continue, we can see that we have the youth that are in our secure care population and what their ratings are. And it's very few or low. And as I stated before, that could still be beyond our control. That could be because of the type of offense they committed, and state statute might require they be there. But if you see a large majority are either high or moderate. And even with the moderate, and for this particular slide, it could mean that they just arrived at the facility and they're getting ready for reassessment, and so sometimes they're working their way out. So it's important to note that the key to this slide would be the very, very small amount of low-risk kids who we have put in our secure home facility. Okay? And so at this point, I'm going to ask Dr. Vincent maybe to jump back in and kind of share a little bit more information, and then I think we'll take some questions.
Thank you, Kelly. I'm going to try to get my webcam back up if I can here. So it's really great to have Kelly show you the whole outline of the process that they followed in Louisiana. A lot of those points are critical when it comes to implementation, and also hearing about some of the barriers that they went through or addressed is important as well. I noticed a few things from Kelly's talk that I thought that I should just highlight here, partially because of some of the questions that I see coming in. first of all, neither Kelly or I really did a thorough job of explaining how these risk assessment tools work. They're not based on subjective information or subjective data interpretation. They are conducted with the rules of any good forensic assessment. So what that means is that probation officers are trained not to take kids' words for it or parents' words for it, for whatever the questions that they're asking necessarily, but they're supposed to gather all the collateral information that they can to make sure that they're getting truthful and accurate information. So that's just a rule of forensic assessment that we would say. You would never base a risk assessment tool on the self-report of the youth or the self-report of the parent alone. You always want to take both of their views, interviews from both of those parties, and combine them, and in addition get collateral information as well. So that includes school records, any kind of mental health assessments that were done in the past, any prior information from juvenile justice history, and so forth. So these tools are not subjective, and again, when I mentioned that having a tool that's reliable is critical, knowing that a tool is reliable means that the probation officers or the individuals rating the tool are interpreting the information in relatively the same way. So these tools have manuals that are really clear about how the items should be rated based on the kind of information that's obtained by the probation officers. So these tools are reliable, and in fact, we didn't present this data to you, but an analysis was done in Louisiana showing how well probation officers were able to rate the savory and how reliable they were at doing that. So they did a big field study to determine that and make sure that everybody was up to par with respect to their ratings. And so I think it's important to just highlight how these risk assessment tools actually work, that you're not just taking a single person's word for it when you're asking them questions. Also, these tools contain information about substance abuse history. They contain information about prior violence history, prior offending history, and a lot of variables are in the savory and many of these other risk assessment tools about that will help you gauge somebody's, I guess, reoffending potential. That's the point. So you're looking at their ability to manage anger. You look at their ability to deal with stress. You look at their impulsivity. So a lot of these are risk factors that are included in these tools as well that give you information about that. I want to make one point that Kelly showed the need areas that are in the savory, and one of those need areas is mental health or emotional stability. These need areas are not in the savory itself. This is the way that the items were put together in order to report need areas in the state. And the mental health need area on the savory is not actually referring to mental health diagnosis. So it's not necessarily what you all would think, but it has to do with symptoms that may relate to mental health problems. Mental health issues tend not to be in risk assessment tools, at least they're not contained in the overall scoring of the risk level, because mental health is typically seen as a responsivity factor. So if a youth has a significant mental health problem, that could affect their risk level, but it's mostly to the extent that that mental health problem might need to be addressed first before any other type of intervention can be done with that kid. So we see it as a responsivity factor. And it's definitely, as Kelly mentioned, you wouldn't use the risk assessment alone to decide what a kid needs. Often these risk assessment tools are supplemented with some kind of mental health screening tool to tell you if you need a psychological assessment as well. So I'm going to just add that Kelly did a great job of reviewing data that they report in Louisiana, and they're able to see how well the risk level of the savory is aligning with decisions. With respect to disposition and placement, which is really nice, and as he said, the risk tool will not dictate disposition 100%. It absolutely cannot. There's other factors that go into place. So certainly this isn't a way of evaluating how judges make decisions. That's not the purpose. But it is looking to see, are your high-risk kids going into, where are your high-risk kids going? Are you keeping low-risk kids out of placement as much as you can, and so forth. There's other types of reporting that states do that we would recommend too, and that is looking at how risk level aligns with supervision level. So many states use risk assessment tools to determine how much they're going to supervise a youth while on probation. So another kind of graph that you may want to produce for those of you who have risk assessment tools in place is what proportion of high-risk kids are being supervised intensively, and how often are low-risk kids being seen. So these are also graphs that you may have in your jurisdiction that are important. Another area that's important is looking at reassessment. And Kelly and Louisiana, they've done some great data around this. There just wasn't necessarily time to show that, but it's looking at are kids actually overall in aggregate data reporting, are reassessments looking better than the initial assessments? So you want to see, do some of these need areas look like they're actually improving? And if you report that by region, or you even look at it by the types of services kids are getting, that may give you a sense of what services are working for what particular types of kids. Lastly, so that we can get to the questions, I'm going to leave off with just a bit of contact information so that you can contact either of us. And also want to mention that there are some Models for Change resource partnerships that are funded by the MacArthur Foundation. One of them is NCMHJJ. They have a mental health and juvenile justice collaborative for change. They can help with selecting mental health kinds of assessment tools as well as risk, and we do a lot of work with them as well. The RFK National Resource Center for Juvenile Justice Children Action Corps is another resource center where you can get information about how to get technical assistance related to probation work specifically. So I'm going to cut off there and turn it back to Jema so that we can do some question and answer.
Okay, thank you, Dr. Vincent, and thank you, Mr. Clement. So one of the questions is, and I think this is more for you, Mr. Clement, is during your reform efforts, did you select a tool first, change policy first, or do, I guess, both simultaneously?
Okay, so what we did was actually through the MacArthur grant, we were able to use Dr. Vincent's services from NISAP, and so she presented to us four, I guess, of the leading tools that met the criteria that we were looking for, and then we selected the tool. We did not develop the policies until after we selected the tool.
Okay, and how long did this process take from start to finish to implement changes across the entire state?
Okay, I mean, from the time we started with our pilot regions until we really felt comfortable that, you know, it's so-called implemented, including our secure facilities, I'd say it probably took us close to 2 years. Now, we brought those aspects on sooner, but I guess I'm just referring to that comfort level that, you know, yes, it's implemented and we're really starting to make some headway here. So it wasn't a very quick process, but we wanted to make sure that we did it right and kind of bring on certain aspects, you know, as we went, instead of trying to roll it out to the entire state in all aspects in one shot. And it actually worked well for us to do it in steps.
Okay, great, thank you. And this question, I think, is more for Dr. Vincent. Does mental health often sway the results of the tools from one end up the risk spectrum to the other?
Yeah, that's a great question. So as I mentioned, mental health is seen as a responsivity factor. So most risk assessment tools will incorporate aspects of mental health, but not diagnoses per se, and not necessarily, there's some mental health symptoms that you're not going to see in risk assessment tools, and that's because some mental health symptoms are not related to reoffending. Some mental health symptoms are related to reoffending and some are not. So we typically recommend that if a youth has got a mental health issue, that they get an assessment from a psychologist or clinician, and that information be incorporated into the predispositional planning. Mental health won't necessarily sway one's risk level up or down, but it's something that needs to be addressed in a case plan in order to, for some kids, not all, but for kids who are having a significant mental health problem that's going to interfere with their ability to respond to other types of services, that mental health problem will need to be addressed. So, for example, if you have a youth who's psychotic, you're not going to get anywhere with them in a group treatment program or in some kind of other juvenile justice intervention until you deal with that psychosis first. So the answer is mental health doesn't necessarily sway risk level up or down in the way that we would think of that traditionally, but it's something that needs to be taken into account in the case planning, and it may need to be addressed right away.
Great, thank you. The next question, it's a two-part question, and maybe both of you might have input. Should the service plan or case plan be part of the probation agreement? And to clarify, so staff using the plan of care state that they can't force a child to attend a program and can't revoke on the plan of care.
So, Kelly, is it all right with you if I answer that one first and then?
Sure.
Okay. So this is really interesting, and in our work nationally, we've seen different states handle this in very different ways. In some states, it's been really clear that all services kids are going to receive while they're on probation, it's right in their disposition and it's decided by the judge. And the probation officers don't have a lot of leeway in that because it's part of the disposition, it's part of the conditions of probation. In those cases, it's all the more important that the risk assessment tool be used to inform the disposition. Otherwise, the kids aren't necessarily going to be getting the kinds of services that they need that align with their criminogenic needs. In Louisiana, and I'm curious about this, Kelly, your probation officers have a lot more leeway in terms of the case planning. And I wonder if you could just explain how that works there.
Yeah, right. So we're usually, what we're able to do here is we do not necessarily incorporate the need areas into the actual judgment. I mean, in some cases, they're able to put that in, but because we want to be able to update the service plan regularly and remove some need areas and add some need areas, it's kind of a working document. So a lot of the courts